Hi all, Obg Unit 4 Vaginitis. As the word says, it is an infection, inflammation of the vagina. Okay, it can cause discharge, itching and pain to that particular part, perineal area. Okay, so I repeat the definition. It's an infection, inflammation of the vagina that results in discharge, itching and pain. Now, what is the cause of vaginitis? It can be either bacterial infection, fungal infection, parasitic infection, that we will be discussing in detail. Okay. But the most commonest cause is bacterial vaginosis. Okay. That means the cause is bacteria. Okay. Now, in bacterial vaginosis, there is good bacteria and bad bacteria. Okay. Bad bacteria means which is in the absence of anaerobes. Okay. Absence of oxygen. Fine. So this is mostly seen in multiple sexual partners, okay, or the woman who is not sexually active. Okay, so bacterial vaginosis is seen in women who are not sexually active plus multiple sexual partners. Fine. The next one is yeast infection. Yeast infection means it is caused by fungal infection. Okay, especially Candida albicans. The fungi name is Candida albicans. Okay. Yeast infection is mostly seen. Okay, especially in the folds of the mouth. Okay, skin folds, mouth, nail beds, and all this fungi get easily attacked, and even in the diaper rashes and all. If you see, it will be present. Okay. The next one is Trichomoniasis. Trichomoniasis is caused by parasite. Okay, it is usually transmitted through sexual intercourse. Okay, Trichomoniasis is a parasitic infection. So we discussed about bacterial infection, fungal infection and parasitic infection. Okay, then in men Trichomoniasis, it affects the urinary tract, but there is no signs and symptoms. Okay. At the same time, in female, it infects the vagina and then it causes signs and symptoms. Okay. Then, what is the risk factors of vaginitis? Okay. Sexual activity, hormonal change, sexually transmitted diseases, diabetic mellitus, use of IUDs like copper T insertion. Okay. And then condoms. Okay, like permanent condoms, external condoms, right? Female condoms and all. These are all the IUDs which used to prevent pregnancy. Then wearing tight clothes and all. Okay. Then overuse of antibiotics and steroids can also be a cause of vaginitis. Okay. So these all are the risk factors of vaginitis. Now we discussed about the definition, we discussed about the cause, we discussed about the risk factors. What is the signs and symptoms? The common signs and symptoms are like itching will be there, irritation will be there, pain will be there both while maturation and intercourse. Okay. Then vaginal bleeding or spotting we say. Okay. Then there will be a color change, odor change and white discharge. Okay, from the vagina. Now as per the cause, what is the specific signs and symptoms is like in bacterial vaginitis there will be a grayish white discharge. Okay, and there will be a foul smell which smells like a fish, dry fish. Okay, and mostly that smell will be in the peak level while intercourse. Okay, then yeast infection, the main symptoms is in itching, there will be white thick discharge which will be resemblance of a cheese. It will be resembling like a cheese. Okay. Trichomoniasis, greenish yellow discharge will be there. Sometimes it is very frothy. Okay. So we discussed about the signs and symptoms. Now what is the complications of, once again, one more cause is there, non-infectious vaginitis. Non-infectious vaginitis is like the use of cosmetic items, okay, which can cause allergy or irritation to the vulva or vaginal tissue. Example like vaginal spray, vaginal douches, perfume soaps and all. When you use it, that chemicals causes itching or allergy reaction in the vaginal tissue. Okay. Now what are the complications? Complications Usually these people don't bother about the complication until and unless they go for a pregnancy test. Okay, in pregnant women, bacteria, Trichomoniasis vaginitis, okay, what happens is like delayed deliveries will be there, or premature deliveries will be there, low birth weight babies will be there, then there is a higher risk of HIV. Okay, now how do you diagnose vaginitis? Usually we do history collection, physical examination, pelvic examination, blood test will be done so that you know the exact cause, what is the infection. Okay, management, treatment will be as per the cause. As we discussed, bacterial infection, so the management will be antibiotics will be given for the patient. For example, we can give metronidazole. Okay, then yeast infection, already in the cause we said it is an fungal infection, right? So we will give antifungal drug. Okay, for example, we can say miconidazole. Okay, trichomoniasis, same bacterial infection, so we will parasitic infection, but we will be giving the same treatment of antibiotic. Okay, non-infectious is like we said that it is because the use of any cosmetic items which is used, okay, chemical reactions and also. What is the first thing is like we have to avoid the cause of infection. Okay, then topical estrogen will be applied to avoid irritating. Fine. So this we discussed about vaginitis. We discussed about definition, etiology, risk factor, signs and symptoms, diagnostic evaluation and management. Nursing management should be prepared by yourself. I hope you all received the notes also. Thank you.